Hi everybody, this is a summary of what's going on with Steph. I hope this helps answer some questions until her appointments and provide you with some comfort. What we know so far is that she has a small mass in her left breast. It's 18 to 20 millimeters in size and it's called an infiltrating ductal cancer. Its hormone status is ER positive, PR negative. Both the size and this hormone receptor status are very important in determining how she's going to do, and fortunately both of these have come back in her favor. The 18 to 20 is an important cutoff when it comes to the staging, and I'll talk about that in a second. And the hormone receptor status is important in terms of its responsiveness to treatment, particularly with a drug called tamoxifen, which is very effective and non-toxic in the treatment of breast cancer. We think at this time that her lymph nodes are negative based on the ultrasound, but that will be confirmed at the time of surgery in terms of if there are any microscopic signs of spread. Based on the size cutoff right now being 20 millimeters or less, and the fact that lymph nodes are negative, and assuming that there isn't any distant spread, which I don't think there is in my gut, this would be stage 1. Because of the hormone status being estrogen receptor positive, this gives a very favorable outcome, as high as 95 to 97% survival for 10 years. So that's excellent when it comes to cancer treatment. It doesn't get any better than that. One of the questions that needs to be answered at this time is what is her gene status in terms of her risk for future breast cancer. And that gene, the more important one, is called the BRCA1 or 2, and that will determine, or that can be used to determine, a person's long-term risk for recurrences in either the same breast or the opposite breast, and can be helpful in deciding whether or not to go forward with simple lumpectomy or single-sided mastectomy or both-sided mastectomy. My personal opinion, given her age, would be to go forward with a bilateral or both-side mastectomy, regardless of her gene status, just because of her age. The downside of this approach would be that she would require reconstruction of both breasts, and there is some concern as to whether or not the nipples could be preserved. But that is a discussion she will have with both the general surgeon and the plastic surgeon. She is going to see the general surgeon either on Monday after her appointment with Dr. Jin, or on Tuesday. I was able to get a hold of the surgeon, Dr. Kelly Puster, earlier this afternoon. So I had a long chat with her and was able to get the important information. Lumpectomy downsides would include the fact that she would need 6 weeks of radiation therapy after the lumpectomy. Also, she would have the chance of recurrence in either the same breast or the other breast. Depending on her gene status, of course, that risk could be higher or lower. And even with lumpectomy with larger breasts, there is some concern over deformity. So after hearing all of the pros and cons to both, I think that bilateral mastectomy is probably her best choice and something that I would recommend. But again, we'll have more information when we hear from all of the specialists involved.